David, thanks so much for joining us. You know, we're really looking at the history of echo, the history of the society. How did you get, what year and how did you get interested in the field of echocardiography?
Well, I got to San Diego in 1969, trained with Bill Friedman, who became my pediatric cardiology mentor. There were two guys that I knew of, Solinger, Bob Solinger and Richard Meyer had been doing some M-mode echo in neonates. And the reason they did that, there was a guy named Lundstrom from Sweden who was also a pioneer, because a baby turned blue and you didn't know whether it was lung disease or heart disease. Sure. So you ended up catheterizing kids that didn't need to be catheterized. And just by finding the ventricles and finding the aortic valve and then learning where the pulmonary valve was, you could separate out those kids that had lung disease. And then we sort of learned to look at ductuses. It was all M-mode then.
Right,
there was a guy named George Leopold who was a radiologist, and a lot of us started out learning from radiologists. He had a SmithKline M-mode machine with a Polaroid camera, so I learned to do echoes, and so it became an important service. And then Bill Friedman knew Paul Hugenholtz at the Thorax Center. And so well, Bill and I had a deal. He wanted 2 papers in circulation or I was going to have to go to the lab and glycerinate muscle fibers. And I said, I want to do this echo stuff. He said, well, show me that it's academic. So Bill arranged through Klaus Baum, who had invented the first 2D scanner as a linear array, built it in Rotterdam, and they sent one to Rich Pop. They sent one to a guy named Ron Priety, and they sent one to me with even a 7 megahertz linear array transducer.
What do you know? When are we talking? What year?
We're talking about early 1970.
Okay.
Charles Lonsay came over and set the system up. I beat Rich Pop to do the first 2D echo on this continent by about 20 minutes. I know that because we were on the phone, and I found a button, a switch on the bottom that said 50-60. And it was set on 50 because they'd shipped it from Rotterdam. I was smart enough in terms of engineering to switch it to 60. And so I echoed Paul Pitlick, who was a fellow who was Marfin's.
Tall Paul.
Yeah, Tall Paul. So that was 70, and I had the opportunity to do a number of things first. I moved to Arizona in 72. Stan Goldberg and Hugh Allen were real believers, and so we really put it into mainstream along with Roberta Williams and a number of other people, Norman Silverman. And so by 73, 74, we were giving courses in pediatric echocardiography and sort of having the opportunity to lead our field. And I met Walt Henry, and so Walter and I began talking about the differences between linear array scanning, which worked
and
well
that's what
in babies.
You were using.
I was using linear arrays, but babies don't have a lot of cartilage in their chests, so they really have a bigger window, and linear arrays worked pretty well.
Yeah.
Walter had built a 30-degree mechanical sector scanner, and we had an opportunity to use it and learn about it. And then, of course, the sector scanners came afterwards. Eggleton built a mechanical sector scanner for Harvey. Right. And then so 2D came along.
Did David, so in the very early days that you were doing this, you mentioned an initial need. What niche did it suit for the pediatric, the congenital kids and stuff like that?
Well, it was initially diagnostic. Okay. And then sort of there were advances in neonatology and a lot of small babies who had patent ductus, persistent patent ductus, and it was a volume load. And you couldn't see it in those days. We didn't have the resolution, but you could measure the volume load. So you could detect babies that needed to be treated for ductus arteriosus. That was mostly surgical, but it later became pharmacological. So it really became integrated into neonatal care. And Stan and Hugh and I worked very hard in Arizona, again partnered with radiologists. Yeah. We started doing sector scanning. We had first crack at some of the Honeywell Doppler stuff. Right. And then a guy named Loda Longa from Berlin came over for a year and a half, and with Kathy Reed, who was an obstetrician, we did the first 2-dimensional fetal echocardiography and published a paper in Circulation in 1975. Charlie Kleinman from Yale, who's actually receiving a Founders Award at this meeting, had pioneered fetal echocardiography as M mode for arrhythmia detection and to some extent for making anatomical diagnoses. But it wasn't easy to do M mode diagnosis in the fetus, but 2D came along pretty quickly.
How did you get interested? How did you get involved with? Obviously, you're in the early days. You were were you the earliest pediatric cardiologist really grabbing hold of echo and running with it?
No, I wasn't. I mean, the names I mentioned, all of these guys were career dedicated.
How did you get involved with the society? I mean, how did that?
Well, the other advantage that I really had was I had some engineering tutors that really taught me how to talk to the industry.
Okay.
And, we had special needs in terms of aperture, in terms of frequency.
Sure.
And so I began learning how to talk to engineers, finding a common ground, and having really good collaboration with companies as they were developing new technology. And especially among the PEDS guys, I was sort of the guy the companies would go to look at their new advances. The society, as you know, was founded at a meeting that Harvey gave in Indianapolis, and there was a need for that, and I was sort of pleased. Roberta Williams, and I were sort of the pediatric folks that were at that meeting, so we became the core of the founding group of ACE in terms of the congenital heart disease side. And it was an exciting time.
Oh,
I remember the energy in the organization. It stayed small, but it grew progressively. Joe Kislow, as you know, was the one that really anchored it in terms of getting a management structure underneath it. Roberta was the treasurer before I was treasurer. You probably know this story, but she bounced a check for the entire value of the treasury when she transferred it from Boston to Tucson. She'd written the check off an operating account that didn't have most of the money in it, and I got paged off a ski slope in Taos to be notified that the whole treasury had bounced.
You became the 6th president, okay?
Yeah.
But so you were there. So you were there at the inception of the American Society of Echo.
Yeah.
Okay.
Yeah.
And when you became president, you remember what size the organization was? And,
I would think maybe 600-700 people.
Yeah.
Tony was president before I was. I was the first pediatrician.
Yeah.
And Al Parisi succeeded me. And it was a pretty dynamic time. I remember among the issues was growth.
Okay.
One of the issues that we talked a lot about was the sonographers, how to include them, where we would turn for certification for sonographers. There were several groups from SDMS and from AIUM and from the vascular societies that were anxious to find an alliance with ASE. And I think we sort of took a neutral policy at that time, rather than sort of favoring one organization compared to another for credentialing.
Were you the first? So you had an interest in the whole sonography issue, how to get them certified, get them
integrated.
Yeah.
And that's been very characteristic of our field. That sonographers are professionals and they're our colleagues. And,
absolutely.
And so we've taken care of them from the get-go.
And they've taken care of us.
Absolutely.
And I think that's part of the uniqueness of our society is that they really are colleagues. Yeah. As you've watched the development of the field, and I know we'll talk about echo in general. Would you have envisioned that it was going to go the way it's gone?
I believe that it was going to become a major modality for diagnostic and follow-up care. I think coronary disease was a tougher target than congenital heart disease. Congenital heart disease was morphological. The abnormalities were apparent.
Right.
To start dealing with coronary disease, I mean, it took not only just looking at the heart, but stress echocardiography and pharmacologic and then perfusion. I mean, coronary disease was more difficult. The patients were more difficult. They had different kinds of disease. They needed acute diagnostic care, but it didn't become front line as quickly as it did in pediatrics. The other issue was the issue about a national meeting.
Right.
That discussion had started when Tony was president,
okay.
but there hadn't been a conclusion reached. And I remember appointing a committee. I know Jules was part of it, and there was a committee appointed to sort of assess what was a big decision for us.
Financially, or just, I mean,
both. I mean,
yeah.
Did we want another meeting? Would people go to another meeting?
Right.
Were there enough people that would come? What were the finances of a meeting? What was the role of industry, and was it big enough to support a meeting? And I think that during my presidency, the decision was made that a meeting was going to occur, and that issue was handed to Al Parisi in terms of the implementation of the decision to have that first meeting, which was in Washington, D.C.
That's amazing.
In Crystal City.
Absolutely. It's amazing.
And it was pretty successful. I bet it had 700 people. 500.
Yeah, no, Al and I had been talking about that. It's an interesting concept. David, the world of pediatric echo, I mean, the world of pediatric cardiology has changed drastically. I mean,
yeah.
As you think about not only what can be done, but the aging population now. You have people that have survived as technology came along. So the adult congenital, the pediatric sort of stuff, I mean, echo still is the
Echo is
central.
still very important. The population is more complex. Some of it has to do with really understanding the mechanics of some of these weird, underdeveloped ventricles as patients age,
right.
What the natural and unnatural history is of the corrections that are done. That there are very few of them that are curative. A lot of pediatric diagnostic and therapeutic imaging was substantially enhanced by color Doppler, which Emoto had really pioneered.
Right.
We had the first Aloka system in San Diego when I moved back there in '82. So we sort of pioneered color Doppler, and then we spent a lot of our time trying to understand what it actually showed. You know, what was blue, what was red, how did you really make sense of it? We had the first opportunity to do spectral pulse Doppler with Honeywell. So, you know, we managed to manipulate ourselves into the front line.
So yeah, which is interesting because you were a small segment of the population, and yet you were critical to the development of the field.
Yeah. The other thing that was inherent to understanding color Doppler was fluid dynamics. And so the relationship between the heart walls and blood flow, and when color Doppler came along, you know, the meanings of acceleration and things like that. And we had a guy named Rekusani who approached me at an ACC meeting with a yellow pad full of differential equations, and he had figured out what became the isovelocity contour acceleration phenomenon that we used to call flow convergence, but is now generally called PISA.
Right.
And Franco was from Pavia. Ajit Yoganathan was a fluid dynamics guy in Atlanta.
Sure.
And we wrote the first in vitro study on PISA during an American College of Cardiology meeting. We grabbed the Toshiba machine, brought it over to Georgia Tech, and ran a bunch of in vitro orifices and realized that we could actually calculate flow through them. So it was really fun. And it was relatively easy to do new stuff. If you sort of looked at interesting sidearms like fluid dynamics, you could find enough things to keep you busy, and that really hadn't changed. This whole new understanding about cardiac wall mechanics and strain and torsion, I mean, that's been an opportunity that first arose out of tissue Doppler, and now really is back towards feature tracking, and it represents a really interesting opportunity for echocardiography to remain competitive. MRI can do a lot of the same things. CT is not nearly quite so good for really looking at myocardial mechanics, although it's great for looking at anatomy and coronary anatomy. But I think that echo is pretty well positioned compared to MRI to continue to be mainstream stuff. And I love the way the society has grown. I think that a meeting like this, the rooms are full in a very big hotel. The program is excellent. People are really sitting through them. There's a relaxed part of the dynamic atmosphere collegiality
Sure.
and people who really are knitted together into an organization that they're very proud of.
You know, that's an excellent point. I think the thing that has always struck me is that we, as a group, the Echo world has really been a group that has enjoyed each other's presence. While we would be competitive in an academic sense, we've learned from each other and we've continued to enjoy each other's presence, which I think is unique in medicine.
Yeah. And some of my best friends really are friends that were Echo friends. I mean, Tony DeMaria and I were very close friends. I mean, we've moved together, we know each other's families. I was positioned to sort of make sure that he was considered as a candidate for San Diego at a time that there was a big issue as to whether they wanted a research-oriented basic scientist as director or a clinician scientist like Tony, and you know, and I knew he was movable. But I mean, Walter Henry and I are still close friends. He came to Tucson and taught me how to do sector scanning. We had some really fun times together.
We don't want to hear about that.
No, we don't have to go into detail.
We don't want those on tape.
Driving across the desert in a U-Haul van, being chased by police, you know, with 2 echo machines in the back. And when the cop stopped us, he said, "Well, what's in the back of this van?" And so Walter leans over and he says, "It's echo stuff." And he says, "And who are you guys?" And Walter said, "Oh, this is Ultra Sahn." That was his nickname for me. And of course, the guy had us all out of the van in 10 minutes with our arms up against the side wall. And then we unloaded everything from the back of the truck about 70 miles north of Phoenix, you know, on our way to Las Vegas.
Well, he didn't arrest you, though.
No, he didn't. No, we were clean.
Super. Listen, I really appreciate you taking the time to visit with us. Thanks.